Good evening. Welcome to Left, Right and Centre. I'm Ankita Mukherjee. Prime Minister Modi has launched the Pradhan Mantri Jan Arogya Yojana. The Ayushman Bharat scheme is being described as the Modi government as the world's largest health insurance scheme. Now, under the flagship program, nearly 10 crore economically backward families, or about 50 crore individuals, will be entitled to a health cover of 5 lakh rupees. 31 states and union territories are implementing the program, which is set to become operational from the 25th of this month, which also happens to be the birth anniversary of Pandit Deen Dayal Upadhyay. But the opposition is already questioning whether this will be able to fulfill all the promises it makes. We're asking tonight, will Ayushman Bharat be the game changer that India's healthcare system needs, or will flawed implementation and systemic corruption make it another disaster in practice?
Jharkhand's capital Ranchi playing host to the grand launch of the Ayushman Bharat scheme. As thousands looked on, Prime Minister Narendra Modi promised the poor of India one of the largest national healthcare schemes in the world.
मेरे देश के गरीब को भी वो सारी सुविधाएं उपलब्ध होनी चाहिए जो देश के किसी धनी को मिलती है.
The government promises that under Ayushman Bharat, 10 crore economically backward families will be entitled to 5 lakh rupees each. 8 crore poor and deprived rural families and 2 crore urban workers' families will be entitled to healthcare in empanelled government and private hospitals. 1,300 diseases, including serious health conditions like heart and liver ailments, cancer and tuberculosis, will be covered. In election season, the Prime Minister also used the Ayushman Bharat launch to send out a political message.
पहले सरकारों ने सिर्फ और सिर्फ वोट बैंक की राजनीति के तहत समाज की ताकत बढ़ाने के बजाय राजनीतिक दलों की ताकत बढ़ाने के लिए सरकारी खजानों का उपयोग किया. संप्रदाय के आधार पर आयुष्मान भारत योजना नहीं होगी. जाति के आधार पर आयुष्मान भारत नहीं होगी.
The opposition is countering his political pitch with skepticism about whether the ambitious scheme could live up to its promises. While 31 states and union territories are set to roll out the scheme immediately, Telangana, Delhi, Odisha, Kerala and Punjab have not signed yet. But that's not the only hurdle. The challenges of such a large-scale implementation are many, including funding the ambitious scheme. There are also concerns about private-public partnership and malpractices in a medical system, which has seen rampant corruption.
The things to be checked up is, number one will be that one should not convert one surgery into 2 surgeries. And the second check is it's an election year. We don't want rich people who can afford to get enrolled in the list just because the election time is coming and they want their voters.
While the path ahead may be far from smooth, Ayushman Bharat does bring new hope for families like Rishu Sharma's. 2 years ago, Rishu's father had a heart attack during her wedding and the unexpected medical burden left the family floundering. The family is still in debt, but today Rishu is hopeful.
मेरे फादर को मेरी शादी के टाइम पे अटैक हुआ था तो पैसे की बहुत ज़्यादा प्रॉब्लम हो गई थी. तो अब हमें ये लगा कि 5 लाख का ऑफर मिल रहा है, मोदी जी दे रहे हैं हमें, तो हम अपने पापा का ट्रीटमेंट, अपने घर में फैमिली मेंबर्स का ट्रीटमेंट अच्छे से करा सकते हैं.
The launch of Prime Minister Modi's Ayushman Bharat scheme has invited both applause and criticism. While Rishu and others like her are hopeful, the opposition has raised questions regarding the implementation of this ambitious project. This is Ishika Seal reporting from New Delhi for NDTV.
Well, joining us tonight is Dr. Naresh Trehan, who, of course, Chairman and MD of Medanta Heart Institute. We're also being joined by Dr. R.N. Tandon, Secretary General of the Indian Medical Association. Poonam Mutreja, Executive Director of Population Foundation of India, is here with me in the Delhi studio. But before I go across to them tonight, I spoke just a short while earlier to the CEO of Ayushman Bharat, Dr. Indu Bhushan, and I began by asking him, Ayushman Bharat is obviously being seen as a changer, a game changer in healthcare. But, you know, if you would like to tell our viewers tonight, why is it being seen as such a game changer? What is really, in your opinion, going to make the biggest difference?
One is the coverage. The coverage of 50 crore people that's huge. 40% of the population being covered, and if we combine that with the fact that 6 crore people fall into poverty because of the healthcare related expenditure, this is going to change that and reduce the impoverishment. That's one major feature of the scheme. Second, I would say is that this is going to incentivize private sector, and we'll see many more private sector operations and services in tier 2, tier 3 cities, and that's going to change the face of health sector in the country.
Okay, but already, Dr. Bhushan, there seem to be some concerns about public-private partnership. Big corporate hospitals are reportedly unhappy with the low package rates that are being offered. Now, do you think the rollout of Ayushman Bharat can happen successfully without the wholehearted cooperation of the private sector?
Well, if the question is that can we implement this scheme successfully without the cooperation of private sector, answer is no. But I have not seen that private sector is not keen to be part of this scheme. On the contrary, I have seen a lot of enthusiasm among the private sector players to be part of this scheme. And of course, we are having a very healthy debate with them on the issue of the prices. And we have discussed that the prices may be low, but we need to have more evidence and data to change those prices. And we're working on them together with the private sector partners. And if we get more data and evidence that these rates are low, of course we'll review them.
The other big concern, Dr. Bhushan, of course, is the fact that India's medical system is already riddled with corruption. The previous Rashtriya Swasthya Bima Yojana that had provided cashless hospitalization up to 30,000 rupees was often associated with fraud and misuse. Now, are you concerned about the potential for misuse here?
Well, am I concerned about the potential for misuse? Yes, I am concerned about that, but I am concerned whether this will happen right away. I'm not too sure, because we have actually put in a lot of checks and balances in the design of this scheme to mitigate that issue. First, for many of the packages which are prone to abuse and fraud, they've been reserved only for public sector. For some other packages, we have mandated that there should be a pre-authorization. Also, our IT platform, which will ensure that there should be biometric authentication, also will ensure that the fake people are not provided services and claims are raised. Also, we'll be doing forensic evaluation of all the claims to see if there is some pattern of abuse and fraud. And okay, we have put in a lot of checks and balances otherwise as well. But right, I think this is one area where we can never be too sure and complacent. We'll have to continuously review them, and we'll have to continue to see if the cases of frauds and abuse are taking place and take continuous action.
All right. Now, public health experts and health economists are also saying that the government does not have sufficient funds earmarked for the scheme, that there is not enough clarity on where this funding is going to come from. The budget initially earmarked 2,000 crores in this fiscal for the scheme, and all estimates indicate, including that of the National Health Agency, which is implementing the rollout, that that number is going to fall far short of what's needed.
Frankly, I think those concerns are misplaced, because this is a flagship scheme of the government, and whatever money that we need, government probably will be happy to allocate that money. Right now, the issue is that we ourselves are not very clear how much money is needed, because we are doing this for the first time. And so, in terms of discovering the prices, in terms of premium in different states, and since many states are going for the trust model, how much money they'll need over the year, this is not clear. Second is that we are starting the scheme now, so we need for this fiscal year resources only for half the year. Okay. So, of course, 2,000 crores is not enough, and we've sought additional resources, and we are quite confident that those resources will be available. And based on the experience of this year and first 3 months, we'll be budgeting next year's resources. And I think this is resources not being there is a red herring. I think that's not the problem. The problem is the implementation. Getting and mobilizing all private sector hospitals together, getting the IT infrastructure in place, and also training people who can use that IT infrastructure.
Okay.
So that will be the
Right.
key challenge rather than resources.
Okay, so when you say that implementation is going to be key, what are the biggest areas of concern when it comes to implementation? Now, there were over 15,000 hospitals which applied to be empaneled under this scheme. Several of them have already been empaneled. Has enough work been done to actually ensure a smooth rollout?
I think tremendous amount of work has been done. We have the whole structure of the scheme. We have the IT backbone. We have sufficient number of hospitals in place. And if the question is that can we do more? Yes, of course we can do more, and we will do more. And we'll get more hospitals in place. We'll train more people, and we'll ensure that our IT system works well.
Okay, but some states like Orissa, Telangana, Delhi have not joined the scheme, and that means it can't be rolled out everywhere across the country. Now, do you see that as a problem?
Well, one has to see that how glass is more than 90% full. So we are covering more than 90% population that we wanted to cover, and in that sense, it's unfortunate that not all of them, all the states have not joined. It's important for portability because, for example, Delhi, a lot of people come to Delhi for their treatment from outside Delhi, Haryana, UP, and even people from Northeast come to Delhi. So if Delhi had joined, it would have been much easier for us to have that portability. But we've tried to mitigate that through imperiling some hospitals ourselves. And we have impaneled, for example, AIMS and Ram Manohar Lohia Hospital,
Right.
Safdarjung, with us who can provide services to
Okay.
people coming from outside. But we'll continue to work with all these states, and because as I see the basics and the fundamentals of the scheme will help everyone. It's a win-win-win situation. It will help states because they'll get resources. It will help people of the state because they'll get services, and it will help people of other states because then they can seamlessly have this national portability.
Okay, so win-win-win, you say. What would you say then to critics and naysayers?
Well, they should first give us some time to prove ourselves, and this scheme makes a lot of sense in theory. This kind of approach has worked all over the world and has changed lives of people in a dramatic fashion, and we are all committed to see it through and make it a success here in India. And it's a question of time before we can see the results, and once we see the results in say 6 months and 1 year's time, probably we'll have many more followers than we do now.
Many more followers than you do now. All right, Dr. Indu Bhushan being very candid at this point, the Ayushman CEO, Bharat CEO, speaking to us earlier. Let me take this right across to our panelists tonight. Dr. Naresh Trehan, let me begin with you. Clearly the Ayushman Bharat CEO is very confident at this point, even when we raise those questions about potential misuse, given how things have played out in the past. But, how do you come in on this? Do you see this then as a complete game changer for India's healthcare system?
So first of all, I must congratulate Dr. Indu Bhushan for being so forthright into all your questions that he answered very, very specifically, and that's actually the truth. I agree with it. Instead of a game changer, which is not a very nice word, I would say this is a landmark scheme, landmark day today, because a whole new era has started to provide healthcare to the people of India who were till today out of the healthcare loop. As you can imagine, it's almost half our population, 50 crore people. And we are very aware of the fact that illness is the same whether it is to a poor man or a rich man, and his life is as valuable as a rich man's life. So no country can be proud of the fact that half your population is suffering because the country could not provide health care to them. So I must say that this is a great beginning. It will have huge challenges as recognized by the CEO, Dr. Indu Bhushan. He said it very clearly that look, this is a beginning. The beginning had to be made at some day, and I'm sad that it has taken 71 years for us to get here.
Absolutely. Absolutely. But Dr. Aryan Tandon,
so there is no criticism of starting the scheme.
Right. No,
so
of course.
I'm saying, to the naysayers that you are saying, I would like to add, there is no negative to it. There are challenges to it, but we put our shoulder to shoulder together, and we also join with Swachh Bharat. We can reduce the disease burden, and we can deliver care to the people at last man standing on the soil of India. If we can do it by our 75th birthday, we would have done a huge service to our country.
Dr. Tandon, would you agree with that assessment?
There are two very important things. Look, the Ayushman Bharat is definitely a good thought process of a government, but it has come little late. This government should have taken it on this scheme at least in 2014 and otherwise 2015. Then they could have seen what is happening and what is going to happen in the 4 years and how they want to change the scheme. The most important thing is all the 40% of the population of India is getting treatment through the various small hospitals and nursing homes in remote areas, in villages, in Tier 2 and Tier 3 cities. So it is not that they are not getting treatment. They are getting treatment, but the biggest challenge was that they were paying from their own pocket, and which now will be done by government through the insurance packages or through the trust model. That is a good thing. That is a benefit for the population, and we are for it. But most important thing is how they are going to implement. If they not involve each and everyone who is providing health care to people of India today, then the scheme is not likely to fulfill the aims and objective of the scheme. So that means they have to involve all the smallest nursing homes and hospitals in various remote areas, because they are the backbone of Indian healthcare. Everybody is aware that 70% of healthcare is being provided by the private sector. And the private sector is to be taken into confidence. And the most important thing where they have missed is that is the packages. See, the packages are sometimes so low that for few months definitely people can afford to have some losses, but ultimately what will happen? They will run short of money, and the small setups will collapse, or they will shut down, or they may not be in a position to provide
we did hear the Ayushman Bharat CEO say that this is a continuous process.
Because of this scheme.
Yes, that those prices are being talked about, and of course it's not the final word on anything.
I understand. Right, but we have said that the costing should be done in a way that you understand how much is really spent on one of the procedures. So that is going to be very important.
Fair enough. We take your point, but on the larger question,
will be much better.
Okay. On the larger question about the potential for misuse, we heard the Ayushman Bharat CEO say that there are a lot of checks and balances in place. There's biometric authentication, there is pre-authorization in some cases. But we did hear him say that, some packages which are possibly prone to fraud have been reserved only for the public sector. Is that something that you find a little worrying?
No, I don't find that. I don't find that worrying. I think it's a step in the right direction.
Yes, Dr. Tandon, I asked that to Poonam Mutreja. I will come back to you. Thanks.
So, I think greater strengthening of the public health sector is what I would like to see a priority here. Yes, the private sector needs to play a role and step up to their social responsibility, and not only argue or discourage the government at this point of time with prices and costs, because we know that profits in the health sector are very high. There's a lot of benefits that have also been given to the private sector. So I am not going to worry about the private sector not stepping in. Many of them aren't, and those who are obviously have come with good intentions. but the public sector is very weak. I'd like to reverse the question and ask the private sector how they are going to invest in strengthening the public sector, how they are going to play a supportive role. And the public sector is where the primary healthcare needs of a nation are fulfilled, also, and that of the poorest. And secondly, the promotive and preventive measures which are going to reduce the burden are important areas for us to consider and think of. Only 150 wellness centers, 150 lakh wellness centers is not going to be the solution, though it's not easy to do. We should see greater investment, not just in money terms, but in terms of improving the human resources. Human resources is a huge problem in India and the public health sector. So I'd like to ask how we have prepared. Yes, I know the government has some schemes like 3-year training and so on, but we need to have prepared a lot. But if we haven't prepared a lot, I think we really have to welcome the political commitment.
On the larger question of sort of public-private partnership, as it were, Dr. Trehan, if you would want to bear in on this, how closely will the two have to work, and does this go beyond merely what the government is setting out at this point? Will this have to be a continuously changing process which meets the needs of India as a nation?
So my co-panelists have raised some certain very valid points about the concerns. Now, if you look at it, basically if you want to build a healthcare sector for a country, first thing first is you have to reduce the disease burden. The disease burden comes from civic amenities, Swachh Bharat, providing toilets, sewage, all this stuff. That's why I mentioned that Swachh Bharat and Ayushman are twins. They should be working together from the ground up to reduce the disease burden, because we know where malaria comes from, we know where dengue comes from, we know where typhoid comes from. We eliminate that, you would reduce the burden on the system by 30%. Now, 150,000 wellness centers is not a small amount to establish. That means we have now 650,000 villages. So we are saying for each 5 villages, there will be a wellness center. Okay, now the point being of shortage of human capital, certainly this has been an alarm for a long time. One thing is that we don't have to wait till we produce the trained personnel, which we should ASAP. I also am involved with the Health Sector Skill Council, and we are actually training hundreds and thousands of now frontline health workers, Arogya Mitras, and also upgrading the skills. But we can leverage technology today to have the multiplier effect of each healthcare worker there is. So if we build from wellness center where basic services can be provided either by the frontline health worker or a doctor who can be there, and also connected by IT to a larger center, whether it's a government or whether it's a private hospital, by telemedicine, you can actually resolve many of the problems. And also you can tell from that who needs to be referred to a hospital. Today what happens is, because lack of health services, the poor get sicker and sicker. When they look like very sick, they run to the hospital. So there is panic in the system. We need, with this kind of scheme, we can actually, if we do it carefully, and we should not be in a panic that it has to be done overnight. It should be built over a period of time where we can actually add some actually systems where referral systems work appropriately to where.
Okay. Poonam Mutreja, is that a concern that the government is sort of rushing ahead with this for other reasons?
Yes, probably political reasons. There is a urgency, but whatever the political reasons, I still want to welcome the political commitment to health in India. It's going to have huge dividends and returns for us in the long run. We are going in the right direction, and I'm not a political person. I'm not concerned about the politics as much as what happens on the ground and what we learn from the past. I don't believe we don't have experiences in running health assurance schemes. We've had over the last 10 years in 20 states, we've had health insurance schemes, and there is much to learn about not just fraud, but there is much to learn that people don't know how they are being treated or cheated. There isn't transparency.
Right.
And I think it's very important to get community engaged. People should know their rights. People should know what kind of packages are being offered to them. There needs to be a lot of detail, and unless people enter the public health system with knowledge, we are going to, and we must learn from the mistakes of the past.
All right, learn from the mistakes of the past, but also perhaps take on board what we heard Dr. Indu Bhushan saying that this does make a lot of sense in theory and has the potential to change the lives of people in a dramatic fashion. You know, of course, once there are results, I guess, you know, more people will be more convinced about this scheme. But for the moment, we leave it at that tonight. Poonam Mutreja, Dr. Naresh Trehan and Dr. Tandon, thank you for joining us on Left, Right and Centre.